Since the pandemic began, we've been encouraging folks to get tested if you feel like you've been exposed to the coronavirus.
But when it comes to kids, that isn't always done. Let's check back in with Channel 2 health reporter Haley Hernandez. Haley, parents may have a lot of questions about this one, especially with school starting soon.
Yeah, that's right, guys. So when families face a COVID diagnosis, also sometimes parents call the pediatrician only to find out they're not normally concerned with kids getting tested. I wanted to find out why and how to spot coronavirus among kids.
At most testing sites, if you want to test for a child, they want a pediatrician's referral. And pediatricians like Dr. Charisma Garcia say unless the caregiver of a small child is elderly, diabetic, or otherwise vulnerable, it's not necessary.
It's not that we're concerned about necessarily the child not being well from it, but the people around them that have to have contact with them, like their caregivers.
When talking about teenagers, Dr. Chang, pediatric infectious disease doctor with UT Health, agrees.
You're just capturing snapshots in time, and you're not really going to be able to find exactly that moment when somebody becomes infected. And so it probably won't help you prevent that many infections.
Since kids and teens seem to do well with the virus, they say they'd rather preserve the test for people who really need them. And instead, they advise you to be on the lookout for symptoms to know when to keep them home. Knowing symptoms might be more subtle among kids. The biggest difference is a kid might be sick with a cold, runny nose, or even vomiting briefly and then be fine. Pediatricians say the symptoms don't last as long as adults. And growing evidence shows the younger they are, the less likely they are to transmit the virus to others. Dr. Garcia says of the cases at Texas Children's, only a couple had pneumonia.
In general, they're largely well, which kind of leads to the scary idea that they're more likely to spread it because they may not actually know they're ill because they're fighting it off so well.
But teenagers do carry a greater risk than elementary students of getting sick from the virus and transmitting the virus. Dr. Chang advises when talking to teenagers, remember they have strong feelings about what's fair and unfair. He says to point out to them that by social distancing and helping to protect themselves, they're also helping to protect their communities, families, and friends.